all of us know there are several systems of blood grouping, but the most important one are the two systems, that is the ABO system and the RH system. The ABO system is the one which we call it as A group, B group, C, O group, and there is something called as positive also. That positivity is given with this RH system. This RH system will have an antigen called as D antigen, with which it is represented as RH positive or negative. So in an ABO system, already we discussed the RBCs are the one which has the antigens over its membrane and which is giving the blood group to an individual. Coming to the D antigen group, if the RH antigen is present on the membrane of the RBC, that individual will be represented as RH positive. That is O positive means if the person is having RH positive in it. Then RH antigen is absent in a particular group, that person is referred as RH negative. So this is the representation. So finally, let's discuss about the ABO system. How do we do it clinically? There will be a metal tray or something wherein you will pour the anti-sera. This anti-sera or against all the antigens will be present. There will be an anti-sera A, there will be an anti-sera B, that is an anti-sera D. What is this? These are the antibodies. So if a particular antigen is present in an individual, it will create a reaction in that region. For example, see this example in an A positive person, when the blood is mixed with this antibodies, what will happen in a positive person? A is positive, so there will be a reaction in the A. The person is having A antigen, so obviously there will be a reaction in the antibody A region. So this will be the reaction here. And since I said it is a positive group, the reaction has to be present in the RH side also. So this is how the blood groups are identified depending upon the antigens. Then coming to the blood groups, A group, if I say the blood group is A, what does it mean? He has A antigen on his RBCs. A antigen should be present in his RBCs. And it was seen that whenever a person is having A antigen, obviously the antibody will not be present. A antibody should not be present there. Otherwise, there will be clumping and agglutination. So what antibody will be present? They have seen that in a group person, there is always the presence of B antibody. B antibody. And in B group person, which antigen will be present? B antigen will be present. Whereas which antibody will be present? The opposite A antibody will be present. In an AB person, it's an AB group. So he has to have both A antigen as well as the B antigen. So both A and B antigen will be present. If he is having both the antigen, can his plasma have antibodies against it? Obviously no. Otherwise what will happen? These antibodies will attack the RBC and destroy it. So this person will not have any antibody. No antibodies. In a O group person, O group means he is having no A antigen, no B antigen. No A antigen or no B antigen. None of it is present. So in this person, what will be the antibody? Both A and B antibody will be present. So this is how the blood group is classified. And coming to the RH system, it has one little change there. Whenever a particular RH, suppose if the person is having RH antigen, RH antigen, the person is called as positive group. Will this person have an antibody against it? Obviously, he will not have an antibody against it. But the vice versa is not true. For example, if somebody is not having an RH antigen, for example, no RH antigen, according to our general rule, there should be an RH antibody. But if there is no antigen, then also there is no antibody. No antibody is formed in this person. No RH antibody is seen. So this is an exception to the ABO system. In an ABO system, if a particular antigen is absent, then the corresponding antibody will be present in the blood. These rules are given with the help of a law, Landsteiner's law. Landsteiner is a scientist who has identified this ABO system, and he has also identified the RH system, but on a later date. So what does Landsteiner law states? If a particular antigen is present in the RBC, for example, A antigen is present in the RBC, we call the person as A. Then the corresponding antibody should be absent. It is pretty logical. If A antigen is present, A antibody should be absent. Otherwise, they will cause agglutination. So the example is A antigen is present, A antibody will be absent. This is the first rule, they said. Then second rule is if a particular antigen is absent in the RBC, for example, B antigen. In a B group person, A antigen will be absent, but the corresponding antibody must be present in the serum. For example, in a B antigen is absent in a person, then the B antibody will be present. But right now only for the RH system, we said in an RH system, if the antigen is not present, the antibody will also not be present. So the second rule in the Landsteiner straw, the second rule, there is an exception. What is the exception? The RH system does not follow. The RH system or the positive D antigen system does not follow this rule. Then how did Landsteiner identify both? Initially, Landsteiner identified only the ABO system and he formulated his law. But later on, he found out the RH system. Then only he has understood that it is not obeying for the RH system. But his laws were formulated much before when only the ABO system was available. The RH system will not follow the second rule. Second rule is not followed by the RH system. That is the take home message here.